Welcome to the Friday Focus. My name is Dr. O from E&S Orthodontics, and today what I'm going to be talking about is adult braces. And what I'm going to do is I'm just going to highlight two cases that we've completed in our office that really gets across a couple points that I think will really impact your decision on whether you may want to pursue braces or not. I'm going to be talking about this particular patient, and certain things happen. And I think this goes to the heart of dentistry. There are certain times when you have a toothache or you're at your dentist office and someone says to you, okay, you need a root canal on your molar, your first molar, and your option maybe at the time is, oh, like, I don't know if I want to do a root canal and then I have to do a crown after that. And so your other option is to extract the teeth. And sometimes when we're young and we don't know any better, we just say, let's go ahead and extract the tooth, and then I'll deal with the consequences later in life. Or you're just not able to do that particular procedure. So what I wanted to do is just highlight today this particular patient and her case. And what I want you to do is I want you to see that early on in her life, she had a couple molars taken out. And the consequence of that has been over her lifetime is that these teeth have now drifted backwards, and now there's created a space right there. The other impact that happened is because there's no opposing tooth, this tooth has come down. And so when you decide to take a tooth out, one of the consequences is that you get super eruption, or we get this eruption of these teeth, and it really can impact what you can do later in life. And so when we started orthodontic treatment in this particular case, we did put braces on the top and the bottom, and we got to this spot. And at this particular point, one of the things that this person wanted to do was to be able to chew on the back side of her teeth. She wanted to use her posterior teeth, so what we did is we brought the teeth back together, and then at this particular point, she was actually treatment planned to have a partial. And at this particular point, her dentist gave us a phone call and asked, hey, instead of using a partial, is there any way for us to put an implant on the bottom of that, in that area? And so what was really interesting is we got to working okay, well, let's see how we could do that. What we ended up doing is if you look here, this tooth has erupted about 5 millimeters past where it should be. And then so what we decided to do is we put a little anchor on in the gums right in the bone, and we attached this this closing spring, or a little spring. And what we were able to do is we attached it to the other side and we pushed it up. When we were able to push it up about 5 millimeters, what we were able to do is we were able to go from here to here, and we pushed this tooth up enough to allow the dentist to put an implant in the crown. And this is just one of those things that allowed a greater, this just improved her quality of life, because what it did is it freed her up from any type of partial. It gave her the ability to bite on her back teeth. And so when we're doing adult treatment, or when we're working up a treatment plan, these are some of the factors that we weigh in. And so one of the things I really want you to get out of this is that you really there is an impact on your choices that you make early on in life with whether you pull teeth or not. And I just wanted to use this as a case where this is what could happen if you decided to do that. And then this is what the ramifications were for us, and what we had to do in order to give her the ability to have that tooth back. And so I just wanted to highlight this, but this is just a fantastic case in the difficulty. I wanted to highlight this case because this is a really interesting, it's not a really difficult orthodontic issue. There's some crowding on the top, crowding on the bottom. What I want you to see is it took us about 14 to 18 months to get to this point. And one of the things that we were asking is, well, she was still smiling in a way where she was concealing some of her teeth. And the question became like, well, why are you concealing your teeth? And one of the things that she notices, like, here we go from here to here. And one of the things that she noticed was she was unhappy with how the gums were related to each other. See, when you create a smile, you want the smile from one side to the other side to be symmetrical. And so sometimes just having straight teeth doesn't produce that like wow effect that you want in your smile. And so what you need to do is you look at the gum symmetry, and in this particular instant, the gums, the difference in the gum heights actually made an impact on how she felt about herself and how she would smile. And so what we wanted to do is there's different ways to do this, but we wanted to even out the gum. So what we decided to do was use laser treatment to kind of do like a manicure for the teeth, a manicure for the gums. And what we're able to do is make the gums equal with each other. And you can just see the dramatic impact that had on her, because you can see like it just created so much confidence in her. And that's really the beauty of it. It's like your smile is everything, and it's your window for people. And so when you can create this, these are just like subtle things that impact the smile. And so if this is something that you have a concern about, you should raise this to your dentist, raise it as a concern to your dentist. And then you can also raise it as a concern when you're going through the orthodontic treatment, because there's different ways for us to deal with this, not just using laser treatment as a source, like a solution in this case. So I just wanted to like highlight that, like going from here to here in just a fantastic way, and like she just exudes confidence in terms of her smile. So these are two examples of adult braces. Okay, so these are two examples of using braces in adults to achieve a certain outcome. One is an aesthetic outcome and one is a functional outcome. And you can see the merits of both. One creates confidence and great self-esteem. The other one creates function and gives the person the ability to chew, unlike they've never been able to do before. So adult braces has a multitude of reasons why people should engage them. And so I just wanted to leave you with this message. Adult orthodontics is really prevalent. People are going back and looking at, straightening their teeth, creating a great smile for themselves. And it's something that I think we want to invite you to consider, because I think as we're getting older, what we're trying to do is preserve our teeth. And so having them in the right spot really starts to open a lot of different things for us in terms of health, in terms of confidence, in terms of how we view ourselves. And so I really invite you to come in for an adult orthodontic exam. So I'll just leave you with this. We look forward to having you next week at our next Friday Focus, and thank you so much.